Hey, welcome back, everybody. I'm Jeff Dudan, and we're here today on the Unemployable podcast. Thanks for listening. If you grew up in Puerto Rico, did your residency and fellowships to become a medical doctor in Boston, Florida, and Connecticut, and throughout your career became a 4-star admiral in the U.S. Public Health Service, was appointed by President Bush as the 14th Assistant Secretary of Health, and other roles with the MD Anderson Moonshots program and that cancer center, and chief medical officer at American Express, your name can only be Dr. Joxel Garcia. Welcome, sir.
No, thank you, Jeff. I actually, as soon as I get the podcast, I'm going to send it to my mom so she knows that I work for a living. So that's good.
I'm sure she's knows all of that, and I'm sure she's very proud. It's good to see you. We're old friends.
Yes, we are. And for the people that are listening, when I met Jeff with some other friends of ours, he showed a lot of leadership. And I remember one evening we were just talking about the future, and Jeff had so many great ideas, and he's definitely a visionary leader. So
I appreciate that, sir. And it's an honor to have you on today, and it's been an honor to get to know you. My opening question for you is, what is the biggest health challenge that you think about facing us currently in the United States?
I think right now the number one disease they will always tell you is cardiovascular, but we have so many medications and treatment for that actually is the number one chronic disease. But the biggest challenge that we have is cancer. And not only elders with cancer, but now we also have a big challenge with children's cancer. So from children to adults to seniors to women to men, everybody's being affected by that disease that I hate so much. I lost my grandmother to cancer, so my mother is a cancer survivor. So cancer has been one of my nemesis that I try to eradicate.
You've served in so many capacities. I've got 2 pages of roles and awards here, one of which was as the Executive Director of the Cancer Control and Prevention Platform, as a member of the Moonshots Leadership Program at the University of Texas MD Anderson Cancer Center, which is one of the premier cancer centers in the world. Talk to us about the Moonshots program, what you did there, and why are we continuing to struggle with cancer as a disease?
So it was an honor to serve there. I still very much involved with MD Anderson. Like you mentioned, is the number one cancer center in the world. And I helped them also open sites outside the United States. There's sites in Spain, they have sites in Turkey, in Brazil, and others. The challenge with cancer is that there's a genetic composition of the cancer, but also there is some environmental effect, and that increases the mutants of the genes and the cells to become cancerous. Right now, I live here in Chevy Chase, Maryland, literally 2 blocks from DC, where I work, and the amount of the increase of cancer rates in this area has been significant, even though I'm only 1 mile from NIH. So cancer actually has diminished the life expectancy of people in our country. And the issue of cancer and the issue of water safety are the 2 biggest concerns that I have right now as a public health person and as a physician. So I think you're very right. Cancer and water are some of the biggest issues that we are confronting here, not only in the United States, but worldwide. I actually predicted that World War III, if it happens, it's going to be related to water access.
And that's counterintuitive. I worked with St. Jude Children's Research Hospital for many years in terms of fundraising. It was our charity at my previous business at Vanaclean. We would go to Memphis and go to Partner Summit and walk the hospital for 3 days. And they, they decreased deaths from childhood cancer, leukemia from 90% to less than 10% over the last 30 or 40 years. Maybe I don't have that statistic exactly correct, but that's the long and the short of it. So you would think as we become more evolved, more health conscious, that cancer would be something that we're continuing to make strides on. But that being said, there's so much exposure that we get. Now, my mom this year, we're sitting here in 2025 in nearly September. My mom survived colon cancer this year. She had a large mass on her ascending colon, so she had a semicolectomy, and it went, and there was some penetration into the wall there, but they got it all out. They reattached everything. All the lymph nodes were clean, so there's no chemo or anything. So she at 81 years old had never had a colonoscopy, had a massive tumor. I mean, large, like 20 centimeters.
Wow.
It was all the way around, and they took it out, but it wasn't an aggressive cancer, and she's doing fantastic. And again, no follow-up treatment. So cancer affects, if you live long enough, cancer will affect you. And as I was doing my research about her treatment, I was connected with different, I don't even know that some of these people were medical doctors, but there's all kinds of opinions out there, but the ones that made the most sense to me had to do with exposure. And just looking around your life, you mentioned water and what's in our tap water that we're drinking. I mean, if you listen to people like Gary Brecka, he says, I'll never drink tap water again if I can help it. I have friends that, talk about fluoride in water. I have friends that, and then you talk about drinking from plastics, and then you talk about and you talk about some people won't wear nylon underwear to bed because they don't want to sleep in the, in these synthetics and all of this kind of stuff. So, what's reasonable in your opinion to control exposure to everyday elements about cancer? And why are we continuing to have these pockets or these hot sites where we're just not really paying attention to some of the cancer causing things that are entering our bodies?
I think, first of all, you're very right. And I, like yourself, my mom, actually, cancer she had was colon cancer, and thank God she's fine now. The water is something very complicated because water is regulated by towns, cities, and state, depending on where you live. I'm just going to give you an anecdote that I was the Commissioner of Health in Connecticut. I was regulating, and I regulated water. And we put millions of dollars in terms of water safety and different new regulations. And then one day I received a call from my chief of staff, and he says, this is going to surprise you, but your town of Avon, which you love very much so, and which is a very wealthy town, very educated town, the water that your kids are having in school is filled with lead. And the issue is that when we have old towns in our country, there's a lot of the pipes, they have lead. So that's one issue. The fluoride issue, as you can see, Secretary Kennedy is not a fan of fluoride, and I respect his thoughts about fluoride. I myself think fluoride is needed to prevent cavities, but there's new studies that have shown that there's some health challenges that may come from fluoride. So that's one thing I wanted to mention about water. The other thing that we have related to water is that in some states, we grow fruits that depend on significant overflow of water. Like if you go to New Mexico, and you look at what they are growing there related to dates and date-related fruits, they need overflowing of the water. And then if you go to states in the Northwest, they have lack of water. So it's a balance that we have to strike in terms of protecting water supplies and supporting people. And so I don't want to sound political, but I think people are using partisanships here to discuss about water, which should be a global issue. I mean, there's countries that I have visited that they cut the supply of water for 4 to 6 hours per day, which is the same thing that they are doing for energy. So we're blessed that we live in America and that we are Americans, that we have access to many things. But in many parts of the world, that's a scarcity. So I think it's very wise from you to mention that.
You've done some work even recently with global water issues. And
yes, yeah.
Yes. And, as you hear people talk about it, desalination to create water, it's expensive. Shipping water is expensive. What are the types of things that you've been involved with that people should know about and maybe think about participating in?
So you mentioned desalination, which is a big issue. The Israelis, they had the best system to take the salt out of the water because where they live. But in many countries, the water is wasted. And here in this country, I mean, we see that all the time. My wife, Remy, she's from San Francisco. So the water there is very well regulated and people are very conscious about how to use water and how to even water their plants and their lawns. But here in the DC and in Northeast, we don't think about that. So I think it would be wise for people to understand that sooner or later, we're going to have a challenge in terms of our water supplies. And it will be good that people start understanding not only the effect related to water and humans, but the water and our fields and essentially the dairy farm. I come from a dairy farm from Atillo, Puerto Rico. It's a very small town, but it was famous because we had more cows than people when I was growing up. And for us, rain was very important, not only for the fields and the growing the food for the cows and the sugar cane farms that we had, but also it was important because when there's a drought, the milk production diminished significantly. Just to give you an example, a cow that is a productive cow has to have a minimum of 18 liters of milk production per day. And we were averaging over 30 liters per day per cow. But that means that we needed to feed them a lot of, not only food, but they needed to be provided with water. So people had to think about that when we're thinking about water supplies. So it's not only about the quality of the water that we drink. I have friends, like you mentioned before, that they only will drink filtered water. And I don't even want, I mean, I live in here in Chevy Chase, but I don't even want to know what I have in my water. That I have filters, but it's a big challenge here as well.
Yeah. Throughout your career, you've been at the forefront of responses to threats to our country by disease, including Ebola, and I think anthrax. Can you share a little bit about that happens, and maybe a little bit about any concerns that you have about outbreaks? Obviously, COVID was a big deal. We had an Ebola scare. We've had anthrax scares. How do you think about security in terms of population security from things like this? And are we doing everything that we need to keep us safe?
So that's very personal. For me, I was blessed to be in the front line when we have the anthrax challenge in this country. Sadly, and I still mention her name in any presentation or conference that I go. Odile Londren was a person that passed away because she inhaled anthrax while she was opening a letter. That letter was part of the letter that was sent to Senator Daschle years ago, and she only had less than 50 spores of anthrax. We learned a lot about that time. When I was in medical school, they will tell you in passing, because it was not important at that time, that you need 100,000 spores of anthrax to kill you. And now we know that that's not true. It all depends on the physical situation of any person, and little amounts like 10, like she had, to thousands like other people had, it will be significant. I'm very concerned about the challenges that we have worldwide of a lot of bad actors that may bring bioterrorism back to the forefront. I had a conference call with WHO and PAO earlier today, and we were talking about water, and then the question came out, would you consider coming back to help us, because we're concerned about some of the surveillance in different countries. But surveillance, it was not only about disease. It's like when you have open borders, there's people that may bring some diseases that we have not seen before. Like, we eradicate measles from this country. We eradicate measles in Latin America. Now measles are coming back because there's countries in Europe and in the Middle East that they actually do not vaccinate. So these diseases are going to start showing up again. And as you saw, it happened in Utah, in the Southwest. So those are big challenges. And then there's the bad actors that actually can bring anything to this country, and we don't know. I don't want to sound political, but that's the importance of having secure borders, because, you know, for me, my passport, my American passport, is the most, I'm very proud of it, and it's the most powerful document when I go outside and this beautiful country. And when I see people coming here, even here in DC, we saw it last week, there were some bad actors that are coming here, not only bringing diseases, and I'm not blaming them, it's that they were not vaccinated, but they came here, and then people in this region got some diseases. But then you have diseases like dengue,
right,
that is in tropical weather, but the way that the weather is changing in the south, I'm predicting that we're going to have dengue outbreaks. We have the Aedes aegypti mosquito in the south, and that's the vector that brings dengue to people. So I know that I'm talking different issues at the same time, but it's you asked me what make me keep awake at night as a public health leader, is these diseases that we were not supposed to be seeing in the States, and now they're happening. And another big challenge is our medical school students, and myself, I was dean of a medical school. And my daughter is going to medical school. They have not been taught about the diseases that we're confronting right now. And that's a big challenge, because if you go to the emergency room with one of the new diseases or emerging diseases, 99% chance that the doctor never saw that disease before. So,
right. And the call you were on earlier was with the World Health Organization?
yes, with the Deputy Director General, yes.
Okay. And you work frequently with them and advise them on population health issues and disease issues?
Yes, actually, I serve as a liaison right now in between the federal government and Congress and WHO. So it's sometimes when you see the politicos at WHO, they want to talk about quotas and funding from the US, but the public health people, what they want to know is how we can continue serving them and helping them. So it's a balance in between politics and the pure public health. So, but it's to be honest with you, for the people that are listening or watching this, to have the opportunity to talk with the Deputy Director General in the morning and then follow that with Jeff Dudan, it's honestly, it makes the day of anyone. So,
wow, right? That's who could ask for more than that?
I actually want to say I'm probably the only person in the world that had that privilege today. So
probably, I would say that's fair. So as you think about, let's tie a few of these things together. So as I'm thinking about the conversation we're having, I'm thinking about diseases that are naturally occurring in parts of the world. And then I'm thinking about tools of, bad actors using AI to create high gain of function in some of these diseases and to be able to then find a way to increase transmission and knock us back. I mean, it's anything that you can do that's going to disrupt the U.S. And by the way, we have just crossed into the land of being unable to put any advertising behind this issue. I might as well put my tinfoil hat right on. But as you think about people using AI tools that are going to be more pervasive to be able to, modify these types of diseases, then you've got things now like anthrax. And is anthrax naturally occurring, or is that a synthetic?
It's naturally occurring. The thing is that you can actually, not only using AI, you actually can create evolution in a lab by yourself.
And it's from feces, right? I mean, from what I understood about anthrax is that like in,
it's not really correct. If you go to, my family doesn't have farms anymore, but if you had gone to my farms, in any acre of the hundreds of acres that we had, you will have millions of spores of anthrax just in the cow poo-poo. And at that time, actually, and this is something that I did, I checked the rooftops of where we had the food for the cows, and then we realized we had anthrax there. And again, AI can actually create more challenges, but AI also can create a lot of good. And we have talked about this before. I don't want to be self-serving here, but we created application called Ferronia Life that we're going to be launching in a couple of weeks. And essentially it's using AI to help women through the entire lifetime related to hormones. And now we added the component for men as well. So we are going to be launching that in September, but with the football season. But the thing is, that's where AI actually can change everything. The sad part of AI is that I myself saw myself talking about something that I knew it was not me, and it was someone created an AI persona about me. So there's the bad things about AI, but I think medicine is going to benefit the most about AI because we will be able to personalize medicine. I have to make a mention here. Jim Addison, a very close friend of mine, and we are like Martini brothers because we're doing martinis when we meet. He won the Nobel Prize for medicine in work that he did related to melanoma. And one of the things that he did was everybody was working in the same thing related to melanoma. So everybody was using something to delay the melanoma. What he did was he thought, like AI will do, what will accelerate the melanoma, and using that accelerator to attack melanoma and cure it. So people that had a stage 4 melanoma that had only literally weeks to live, he was able to cure it. And that's how medicine has changed. And AI was a big factor in the changes of cures for cancer right now.
Yeah, I'm seeing it in the private sector, concierge medicine based upon your DNA. So they'll take tests of you. We decoded the human genome. I don't even know what that means, but I know it was complicated. And then now you've got the ability to look at your DNA and to look at these different markers. And AI is the ability to then say, okay, well, if you've got these 4 markers, then you are more predisposed to dementia or Alzheimer's or these types of things. So now the next logical step is, okay, well, your body doesn't naturally uptake this type of protein. And if you want to push off your Alzheimer's, then you can supplement with this peptide, which is going to allow you to make this type of protein, which then, based on your genetic markers, should be able to extend the quality of your life. Are these people just making money on us, or is that the direction that customization for us as humans is going to go in terms of medicine? And then how far back does it go? I mean, are we going to take genetic markers on babies and say this is the perfect diet for you to have during the course of your life to basically not get the cancers or not get the Alzheimer's or not get the dementia? And are people going to be living to 150 years based on this technology?
So, what you just said, it just described Star Trek, the doctor from Star Trek, and that's going to be the future. I myself, the biggest challenge that I have for not doing any genomic testing on me is the issue of who's getting the information, and this is going to upset a lot of people. But sadly, a lot of the information that we have from genomics that you voluntarily give your swab and send it to, I'm not going to mention companies, I don't want to be sued, but those data points go directly to China. And if I were a cynical person, if you get all the American genomics to any other country that is an enemy of ours, you're creating the predisposition of creating an agent that will eradicate a significant part of our population.
Right.
And I'm not talking like I'm in a sci-fi movie or nothing. This is just pure medicine, pure genomics, and pure common sense. The more data points that you get of your enemy is the easier you're going to attack that enemy. So if we're sharing all our private genomics with foreign agents, this is predisposed for a bad thing to happen in the future. And I don't want to scare any one of your listeners or viewers. I'm just talking pure science here. So,
yeah, we're 5 years past COVID, and in your role as Assistant Secretary of Health, you were the 14th ASH for our country. Again,
yeah,
you were appointed by President Bush. You worked with Dr. Fauci.
Yep. I don't put that in my resume, by the way. He worked for me, as a matter of fact.
Right. I think you were his boss at some point in time.
Yeah.
So look, I'm reaching for my tinfoil hat here, but we're 5 years past COVID. What types of lessons have we learned from our response to it? And, how can that inform us in the future in terms of protecting our population?
So the first thing I have to say, the way we are dealing with COVID right now is the right way. And you're allowing the states and the clinicians to make decisions. You cannot have any egomaniac federal person to create panic, and then panic create bad policies. The lesson learned that is very positive was that the president at that time, President Trump, actually asked NIH and FDA to come up and work with HHS, which is the Health and Human Services Agency, and to come up with a vaccine. The vaccine was created in less than a year. And I say that because before that, vaccines would take close to 13 years to come out. And it shows us that you have to have a sample population, do the testing there, and then move forward. And then as things start to evolve and you find out that some populations may be impacted by side effects of the vaccine, then you modify that. So that's a positive lessons learned. The negative lessons learned is that public health had an opportunity to educate people and actually educate them about vaccination and educate them on basic things of public health. And we used that opportunity to create panic. Public health created two big things in our lifetime. Water safety, that was started in New York by the Public Health Department, and which actually not existed, and that's when they found out that dirty waters and used water was creating disease in the city, and that's what it changed, and it changed public health forever in a positive way. The other one was vaccines. But public health was never in the front line of anything related to national policy in U.S. or in any other country. But then we used that opportunity, and instead of being the great communicator, we created the great panicker. And a specific person that I'm not going to mention took that opportunity to create more panic that it was needed. I myself took the vaccine the first time. Remy, that you know, my wife, and I then decided we're not going to take any more vaccines and let the nature of our bodies deal with it. I'm not telling anyone that I'm advocating for that, but we make that conscious decision. I got COVID, and now I feel like I'm pretty good defending myself against COVID. And that goes like, remember chickenpox and measles, and I mean, I remember, I'm older than you, but I remember when, if one of our cousins had measles, they would put all of us in the same room till everybody get measles, and that was it. And just to give you a funny example, so I never had the chickenpox vaccine, and I had never had chickenpox. And I was worrying why I have not got chickenpox. Maybe I was born from angels. Maybe I'm special. And then this doctor of mine, he said, "Don't be ridiculous. You were a farm boy, so you had cross protection from cowpox from your big farm." So
yeah.
So it's something that is going to be debated for years. I can tell you the vaccine and how we deal with this. By the way, the person that was calling, I just hung on him, was the Commissioner of Health from Texas. So he's probably watching this, or I don't know if you're doing this live or not, but he's probably calling me to tell me something.
Well, let me ask you about vaccines here, because, maybe one of the negative consequences of COVID is this renewed focus and uncertainty around vaccines, right? So, I don't have a medical opinion on this, so I'll ask you for years. But when you mentioned measles, we had it eradicated, then we don't vaccinate for it, and then it comes out. And then, you've got polio now, which is, by the way, I look at polio the way I look at the name Edna. We almost had it eradicated from society, but it comes back and has breakouts here and there once in a while. Should people be vaccinating themselves for polio, for the standard vaccinations that they require children to get before they go to public school? Do we need to revisit those because those have been standards for so long? And then, there's always a risk and return, right? No matter what the vaccine is, a certain number of people are going to have a reaction. There's a small center of people are going to have a severe reaction, but in general, is the population safer? Generally, the thinking would be yes.
So the answer to that is yes, because what we do is herd immunity. So what we want is to have at least 85% of the people vaccinated. And so it decreases the chances of an outbreak. The communities that do not believe in vaccines, you see the outbreaks, measles and mumps, which I see as a common diseases. There's a small fraction of the people that had those diseases that actually passed away. Now, polio is different because I actually have a friend of mine that was a polio victim, and he has a significant gait and he has significant difficulty using his lower limbs. And he's a major polio vaccine advocate, which I am too. The challenge that we have is some countries, including some European countries, they are letting people decide if they're going to be vaccinated or not. And there's some religious aspect to vaccines as well. I personally think people should be vaccinated when they are children, and then that would prevent the bigger diseases. I don't get vaccinated for, let's say, the flu, and I'm going to tell you my rationale. The flu vaccine is essentially is the selection of the top 3 strains of the past couple of years or 3 years. So, but for myself is if I'm gonna get the flu, yeah, I'm gonna be in bed probably 3 days or out of commission for 2 days. But then I'm gonna be immune to it. So that disease I prefer that nature protects me. But for polio, I am a big advocate for polio vaccine. And you internationally, I know you travel a lot. If you go internationally, you're going to see people walking with significant gaits, and it's because they were affected by polio, because polio is not.
You and I worked together on a project almost every day for a year during COVID on a piece of technology that was meant to help populations more safely go back to work. In that, and inside of that, I learned a lot about population health, looking at communities that were more impacted by some of the diseases due to socioeconomic resources, due to diet, due to access to healthcare, and how access to healthcare occurred. As you think about population health and, some of these areas of the country where there's more obesity, and that puts a tremendous strain on our healthcare system, and it causes more diseases, cardiovascular diseases, more, very, very high incidence of diabetes. What role do you think semaglutides should play in reducing people's weight and maybe helping people reduce their susceptibility to these types of diseases that are so pervasive in our society today?
So I have 2 very close friends of mine that use the injections, and they not only have lost significant weight, but one of them is a diabetic patient, and she has improved her glucose control. So I think that they have a significant place in medicine to help people. I think, and I'm predicting this, next month when they come up with the oral medication, when people are able to take it by mouth, you're going to have a significant increase of people using it. When it came out, there was a shortage nationwide of access to the injections, and the reason was the wealthy were actually buying.
That's right.
Directly. And nowadays, the production of the injection has significantly increased. But when it becomes oral, it's going to be much better. And I can tell you right now that I have friends of mine, football friends of mine, that we meet on Sundays for the football games, that they have reactions on their side of the injection, so they stop. So the data is not significantly published yet, but they're going to provide the medications orally, I think, starting next month, and you're going to see an increase in the use of those medications. So the important thing for anyone that is listening to podcasts of yours is that you can have the medication, you can have the injection, the oral when it comes out in the future, but you have to change your habits. Like Remy is forcing me to walk 3 miles per day. So thankfully, I'm doing it, and I feel much better. I have lost weight. And we are eating healthy. We have been eating healthy since I met you. But remember when you met me, I was overweight, and now I am significantly in better shape. Not like you, but I'm in better shape. But I think that's the combination of changing your daily routines to actually changing diet and daily routine. It doesn't mean that you have to be in the gym 2 hours and lift weight for 30 minutes. No, it means that combination of activity. It's not just walking. You have to brisk walk, so you have to pace yourself, and knowing how many steps you do in 30 minutes, and then increase that steps by 25-30%, and that's essentially my recommendations are. And actually, by the way, this is so self-serving. So I have 3 children's books, and one of them is Wilmo Aldi discovers El Yunque. And what it talks here is about 3 secrets of El Yunque, but one of them is related to water, the importance of water and clean water. So I think the combination hydration every day, exercise every day, activity every day, and also never forget 2 things. One of them is a challenge for me, which is sleeping, but good sleep over 6 hours per day, and also be able to lift some weight is a big difference. Even if it's only 5 pounds, it will make a big difference to people. So
I remember a couple of years ago when you were writing the children's books. Who is Audi, and why did you write these books?
So again, this is Guimo Audi. So Guimo in Puerto Rico is the name that we call the hamsters. A hamster is a Guimo in Spanish, and Audi was my dog. So I created Guimo Audi books in a way of trying to teach children public health. So one is about, for example, Yunque is the mountain in Puerto Rico, the highest peak in Puerto Rico. It's a famous mountain. But he travels there, but he meets some characters in his travels to the El Yunque, but the travels are related to talking about water, talking about not smoking, and talking about pure air and exercise. So that's the thing. There's a book also that I published that actually and you're a Polish person as well, a golden palms and blue skies, which is a conversation with 13 leaders in the nation. And I asked them free writing, you write about whatever you want to write, and I will not edit any of that. We will and it's conversations with true leaders, and you will find out, like people like yourself, Jeff, that there's so many different priorities for people, but everybody has the core values that makes them leaders. And that's why I have been very impressed with you, because you are one of the most powerful communicators that I know. But when I met you, you were so humble. I think you were deferring to everybody, and for me, that was the true mark of a leader. You let other people talk, and then you will come with your wise comments. And so, for people that are listening to this podcast and are following you, one thing that they should learn is the humbleness of your leadership, which allows you to have conversations with not only true leaders, but with people, and create some change. So that's essentially the message from my book. And I say that that's the message that highlights how you have become a significant true leader for me.
Well, that's very kind. Who are some of the leaders in the book?
So I have from admirals to physicians, from commissioners of health, to people that have impacted me. So I selected people, including one of my students, as a matter of fact, because if you realize that people that work for you, or actually as students for you, they actually can teach you a lot. And it was interesting when people saw the book and said, wow, you have so-and-so here, and you have so-and-so. Why you asked that student to write a chapter? I said, because I learned a lot from the student, and everybody had to be humble to be able to be a leader. So,
yeah. Is the book available on Amazon?
All my books are available in Amazon. And by the way, I had to say this, and I don't want to sound like an egomaniac, but the first time I saw a check coming from Amazon from one of my books, I was so excited.
Oh, yeah.
I didn't even want to catch it. I just wanted to frame it. So it's pretty cool.
Yeah. Congratulations. We'll make sure that we put links to all of the books in the show notes so people can get it. And tell me the name of that book again, with the 13 leaders.
So it's called Golden Palms and Blue Skies. And the reason on the name, which is important for me, Golden Palms in many cultures, from the Greek to the Israelis, is the highest level of success. It's a golden palm. And the blue skies has to do with Puerto Rico. When I go to Puerto Rico, one thing that I always like to do is go to the beach and lay down there and look at the sky and just meditate. So that's the combination of both.
If you get up early enough, you can hear El Coquí.
El Coquí. Yeah. Actually, someone asked me why I didn't write a book about El Coquí. And I said, well, El Coquí for me is when you are raised in a farm, you wake up because El Coquí. You wake up because the rooster, but you go to sleep with El Coquí. So it's something that no one will ever take from me, the memories of that. The other thing is, we live in when I was a kid, not now, but when I was a kid, we live in a ranch house, big house, but it was a ranch and has zinc roofing. And when the rain hit the zinc, and at 6 p.m., you start falling asleep, because that sound is so unique. It doesn't exist anymore in Puerto Rico because the houses do not have zinc anymore. But those are memories from my childhood that I will never forget.
Love the sound of the rain. And for the listeners out there, El Coquí is a frog.
Yeah. That's a little frog like this.
A little frog with a big mouth. Hey, I do have something that I would like your opinion on, and it's regulation of pharma. So we were talking about the semaglutides, and that would be things like Wegovy and Ozempic. So the government realized that there was a shortage of these types of drugs. So then they authorized compounding pharmacies to be able to create the same product, but outside of the trademark or outside of the intellectual property of the brands. As soon as the companies caught up with production and maybe made it available or had enough supply to get available, they took the ability back away from the compounding pharmacies to create generic, for lack of a better term, products. And the name brand products are 3 and 4 times as expensive as you were able to get it from the compounding pharmacy for just a generic. So, it's basically a peptide, from what I understand. So
right.
it's not something that, once somebody figured it out, that was difficult to replicate. Obviously, we've got intellectual property rights in this. I'm huge on intellectual property because I create intellectual property and I want it protected. And these drug companies spend a ton of money in research and development, and they need to recover that. That being said, man, we pay a lot for prescription medications in this country. What's your view on that? I mean, is there a balance that we can achieve? So, like you said, I mean, basically, things get so expensive that the people that really need them can't get them.
So I agree with you. There should be a balance in between intellectual property. Myself, I have patents, and I definitely always want to protect them. The thing, there's 2 types of medication, in my opinion. There's the specialty medication that are not needed for people in general. So you have medications for plastic surgery type of area, meaning for plastics and making you look better or whatever. Those are not priority medications, but medications related to diabetes, related to cardiovascular disease and cancer, especially cancer, should be made more available to people. You mentioned where I worked before, and that I'm very much part of them, and it's the #1 cancer center in the world, but very few people have access to it. And
Right.
That's something that we have to change. There's some of our best centers in our nation do not accept insurance, so people have to pay cash. Now there's the center that you are associated with, St. Jude, that does everything based on donations, and they are very successful. So I think we had to strike a balance with that. You and I would be able to have access to anything, and in terms of if we are confronted with a disease, but 95% of the people cannot say the same thing. And even if, let me give you an example that is very significantly affected me. When I became the Commissioner of Health in DC, one of the challenges that I confronted every day, because people would actually complain to me all the time, in the district at that time, we were paying for sex change operation and the hormonal support, but we were not paying for Lasix and many other medications for cancer. So we had to take politics out of medicine completely.
Mm-hmm.
And you have politicians that just want to appeal to a certain part of the population, which is a fraction. Meanwhile, the biggest segment of the population that is dealing with diabetes or cancer, they don't have access to it. So,
yeah. Well, hey, while we're getting canceled, let me just go ahead and ask this question. And I ask this question of you because of your international expertise with the World Health Organization and your vast, vast network internationally. The organ trade. There's a lot of, recently, the Epoch Times has published a lot about organs coming out of China. You know, look, as our population health and our healthcare gets better, people are living longer and people need organs, and it's difficult to wait on somebody to have an accident. You're years and years on an organ donor transfer list. But somehow people are getting access to organs. Do you have any opinion on that particular business, or is that just something we should stay away from?
I actually think that should be regulated even much more. I'm a big time Yankees fan.
Okay.
Mickey Mantle had 2 liver transplants during my lifetime. And for whatever reason, he became number 1 twice in 5 years, even though he was drinking. I had patients of mine that needed a kidney, and they were in waiting times. And I remember one of them had to fly to New Mexico to have the transplant. And I remember that patient when she came back, and I was very happy for her. And she said, actually, it was not an American that gave me the kidney. I had to buy it in Mexico, and then they transfer it to New Mexico. So what you're saying is something huge. It's a big, no one wants to talk about that.
No.
It's funny because people see that topic in movies and they get completely, oh my God, I can't believe that happening. But that's happening every day here. It's the same thing about, remember, I was in infertility surgery, and when people came to adopt kids from other countries, and I'm going to say it, when you have a Mexican mother giving for an adoption a black kid or a white kid with blue eyes, you wonder where those kids come from. And at that time, and I'm not going to say that that's happening today, but it was happening during my life, during my time while I was practicing, they would be selling kids from California to Mexico and then reselling them back to the States. So, organ transplants, kids, this is a big issue. No one is talking about that. I mean, Secretary Kennedy is talking. It's the same issue with the mushroom. So a lot of people are using it, but no one wants to talk about them. Mm-hmm. And it's the same thing with transplants and adoptions. People should think, like you mentioned before, how far we should go about this topic. Well, how far we should go about where this kid is coming from. So anyway, I know that I'm changing the topic, but those are things that you asked me before. What bothers you before you go to sleep? And those are, when you go international and you see things that should not be happening or should not be part of the equation, then you realize that definitely there's something wrong and no one is talking about it. And
well, what triggered the question for me was that some of these cancer centers have treatments, but they're cash only. And for people of means and people of resources, you can generally jump to the front of the line or get something. And, you know, on a level that it just doesn't seem right. I mean, if my mother needed a transplant and she was able to survive the required number, I wouldn't want people jumping in front of the line. I mean, it's bad enough at Disney, right? But like when it's I mean, when it's an organ transplant, right? I mean, people are going to get upset. So, you look, there's no solution to, easy solution to some of these conversations. But, yeah, I do feel like these are conversations that we are having more of now. And maybe that's one positive thing of social media. Of course, there's conspiracy theories that happen all over the place. And, it's hard sometimes to separate what's fact from fiction. But there's real issues out there. And so for you, and, constantly throughout your career being at the forefront of Ebola, COVID, anthrax, cancer, all of these population health issues. And now you're doing the work for women with what is it? The Ferronia?
Ferronia Life.
Who is the goddess of fertility, if I'm correct?
Yeah.
Yes.
So let me give you another example. Cervical cancer should not happen in the United States.
Okay.
It takes 10 to 20 years to develop from dysplasia to cancer. And we have something so inexpensive called the pap smear.
Mm.
This is how the politics in medicine work. Dr. Papanikolaou, the Greek doctor that created the pap smear, he never won the Nobel Prize of Medicine because people were upset that he was trying to eradicate cancer of the cervix, which was a money-making for surgeons.
Yeah.
So that's an example. Dr. Papanikolaou never won a Nobel Prize. So actually, our friend Nick should know about this. Maybe he can push it for a Nobel Prize. So
yeah. Our favorite Greek. Well, this has been amazing, Dr. Garcia. I've got a curveball for you, and then I got a fastball coming straight down the middle. But before we do that, where would you direct people to get in touch with you, or to order your books, or to pay attention to what you're doing?
So there's actually two ways. One directly to my email, which is joxel.garcia@icloud.com. But if you go for the book, you only have to go to Amazon and look for my name, and the 4 books would show up. We have a site that we're going to be putting forward, and Remy is in charge of that. So that's why I don't know the site place, but it's related to what we're doing now with our new endeavor related to Ferronia. So it would be ferronialife.com. Ferronia is Feronia life.com. And it's going to be up, I think it's up now or next week. So, and they can actually, and the site will have a site for questions, so you can ask any question. I can give recommendations. I cannot give official medical advice. So I just want to make sure everybody knows that. I'm a licensed physician, so ethically, I'm not supposed to give medical advice. So I will be giving medical guidance. So
it's all about women's health, correct?
Women's health and community health. For example, I'm just going to give. So we are working with this company that does orthopedics. So if there's a question about orthopedics, I would be asking a board-certified orthopedic to give the advice. So, but women's health would be 100% like.
Okay. All right. The first question speaks to opportunities in the marketplace that you see from where you're sitting that others may not. And here is the curveball. Gun to your head, something you care about deeply, at risk. If you had to start a new business in the next 30 days, what would you start? You have to start when you don't have a choice. What would it be? And you're not currently doing it now.
So, well, I'm going to be very biased. It would be something related to health IT. I think that when I was a kid, my favorite character on TV was the doctor of Star Trek, and Dr. Welby, Marcus Welby, which probably 99% of the people that are listening to this don't know who he is. So if you remember, both of them, what made them different is that they were giving advice. So I think any new health IT application related to medical advice, I think it would be very good. The other thing is for anything related to nutrition or relating to exercise or relating to health, is going to be personalized medicine and metrics. I don't think, and you're very good at this, if you cannot measure something, it's worthless. So I was asked the other day in an interview here in DC, and they came out with something that I didn't know. They said, you win 75% of the fantasy pools that you participate on. And I said, actually, I thought it was 90%. And the reason that I win in fantasy is that I not only look at the data, I look at the situational data. And I'm going to give you an example. And if you're a left-handed hitter in Yankee Stadium, you have 25% higher chance of hitting a homer.
Okay.
If you are a left-handed hitter in Atlanta, good luck to you, because it's not 316 feet. So you have to know the data, and you have to know how to apply the data. So that's my answer to your question. It's going to be metrics. It's going to be health metrics. It's going to be understanding your body. And if you remember in the past, people say you are going to lose 25 pounds if you take this diet. That doesn't make any sense whatsoever, because first of all, you need to know the habits of that person, and also the physical attributes of that person and their lifestyle. So if you don't put those three components together, it doesn't matter if you have a solution. A solution has to apply to the equation at hand. So I think that's all about metrics. So that would be my answer to you.
Perfect. Last question. Fastball, Yankee Stadium. Let's see, who's the pitcher here? The big unit, the big left-hander. Who was that?
Yeah. Oh my God, you're blanking. You may blanking.
All right,
when you said the big unit, I always think of the guy that retired.
All right. Well, let's just go with Mark Fidrich.
Oh, Mark Fidrich. Yeah.
All right, Mark. Fastball right down.
By the way, he's 6'7", and the thing is, the Yankees, they're so tall, everybody, that you don't even know that he's 6'7".
Yeah, I don't think he had a great fastball though. I think he talked to the ball, and I think it moved around a lot. But all right. Well, here, okay. Nolan Ryan. Fastball. Here's Nolan Ryan fastball right down the middle. If you had one sentence to make an impact in somebody's life, what would it be?
I think it's my advice. What I would give, I would tell you what I tell my kids. Know yourself, believe in yourself, and believe in God. That's essentially, I tell my kids that every month.
Perfectly said. We'll end it right there. 4-star Admiral, Dr. Joxel Garcia, it has been a pleasure and an honor to have you on today.
No, it has been my honor to be your friend, Jeff. So God bless you.
We will have a martini soon up in D.C. I will come see you.
Okay. Take care.
All right. This has been Dr. Joxel Garcia on the Unemployable podcast. I'm Jeff Dudan. Thanks for listening.